Hello friends, in this video we will discuss the term used for describing the bone fissure. So first we will discuss the terms which are used to describe the elevation. Elevation means the upward projection of the bone. So in this the first is the line structure which is present in the superior and inferior neutral line on the occipital bone. So there is a elevation in the form of line. And the second type of elevation is the crest. So the crest is also one type of elevation. It is not a linear elevation and it is present on the iliac bone, iliac crest, which is of hip bone, and also on the spine of scapula there is a presence of crest. And the second type of structure which is present in elevation is called the ridge. So there are three forms of elevation present in our body. First is the line elevation, second is the crest, and third is the ridge. The ridge type of elevation is present on our medial and lateral supracondylar ridges of our humerus. Medial and lateral supracondylar ridges which are of humerus. So in this way we see the elevation present in our body. So you have to remember this because this is a basic to name anatomical terms in anatomy. So in next video we will see the rounded elevation present in our body and what is the name and where they are present. Thank you.